Welcome to The World Today, a program of Perry Worldhouse, the University of Pennsylvania's global affairs think tank. I hope everyone's safe and healthy during these unprecedented times. My name is Michael Weisberg. I'm professor and chair of philosophy and senior faculty fellow and director of postgraduate programs here at Perry Worldhouse. Today's guests are Dr. Silvia Cassiani and Dean Antonia Villarruel. Dr. Silvia Cassiani is the regional advisor on nursing and allied health personnel for the Pan-American Health Organization, often pronounced PAHO or OPS in Spanish, the Organización Panamericana de Salud, an international organization that works with countries throughout the Americas to improve and protect people's health and is the regional office for the Americas of the World Health Organization. Dr. Cassiani began her career after graduating from the College of Nursing at the University of Sao Paulo, Brazil, and she completed her master's degree and a doctorate in nursing from the same institution, where she later in her career served as a position of Dean of Nursing and then came to work at PAHO and the WHO. Dr. Cassiani has served as regional advisor on nursing and allied health personnel since 2013 and is responsible for technical cooperation with the PAHO member states to promote equity in health and improve the quality of life for the people in the Americas through the development of nursing practice, education, leadership, and research. Antonia, or Tony Villarruel, is the Margaret Bond Simon Dean of Nursing at the University of Pennsylvania School of Nursing and the co-director of the school's WHO Collaborating Center for Nursing and Midwifery Leadership. Tony holds an appointment as senior fellow at the Leonard Davis Institute for Health Economics here at Penn, and as a bilingual and bicultural nurse researcher, she has extensive research and practice experience with diverse Latino and Mexican populations and health promotion, and research in the topics of health promotion and health disparities. She currently chairs the National Academy of Medicine's Roundtable on the Promotion of Health Equity and co-chairs the Strategic Advisory Council of the AARP RWJ Center for Health Policy Future of Nursing Campaign for Action. Dr. Villarruel is a trustee of the American Board of Internal Medicine Foundation and an invited member of the Aspen Health Strategy Group. She is a member of the National Academy of Medicine, as well as a fellow of the American Academy of Nursing and the College of Physicians of Philadelphia. She's the recipient of many awards and honors. She earned her BSN from Nazareth College, her MSN from Penn, and her PhD in nursing from Wayne State University. Thank you both so much for joining us today at Perry Worldhouse, and the floor is yours to give us some introductory thoughts about the global state of nursing, perspectives across the Americas, and the impact of COVID-19 on all of us. So we're going to start with Dr. Cassiani.
Good afternoon. We are in difficult times right now, no? Many countries are experiencing a shortage of health workers, but we know that without nurses and other key workers, the outcomes of this pandemic will be worsening, not just at the health of the population, but it impacts in economy, politics, and other sectors of the society. However, long working hours, a shift to work, high workload, and other psychological hazards led some of the nurses and midwives to fatigue, occupational burnout, psychological distress, or declining mental health. The entire population are applauding the courage and dedication of the nurses and midwives and call them heroes. In the Americas, we have 30% of the nurses, of the global nurses, or 80.4 million nurses. And in many parts of this region, nurses and midwives are the first and sometimes the only resource in direct contact with patients, mainly in rural or remote areas, or even in indigenous population, But the crisis of the global public health provoked by this pandemic in the year that we should celebrate the year of the nurse and midwifery can be an opportunity for more investments in nurses' role, recognize their contributions and the vital role, and accelerate investments. The Pan American Health Organization works with the countries to invest, to value, to respect, and to trust in the nursing workforce.
Thank you so much, Tony. But you are muted.
Sorry about that. So good afternoon, everybody. And thank you, Michael, for inviting us to be here as part of this COVID series. And again, for highlighting both the role of nursing and the importance of the Latin American region in some of these efforts. Dr. Cassiani, it's always good to see you. You were a colleague first, and again, as director of our collaborating center, we've enjoyed your leadership here as we work to improve the workforce, the human resources capacity of nurses in Latin America to improve health. The first thing I want to mention again is the importance of the Latin American region that's again highlighted in this pandemic here. So when I came to Penn, certainly the emphasis on China and some of our other neighbors was important, but I felt, because again, I'm Mexican by background, and because of the work that I've done in Latin America, Mexico, and the Caribbean, really wanted to see who my playmates were here on campus. And I was struck to see the depth and breadth of work in all areas of Latin America. Michael, I look forward to hearing more about your work in Ecuador. In our School of Nursing, we've had long-standing relationships with to prevent Chagas disease in Peru, part of a huge collaborating center in Guatemala, focused on violence as well as midwifery education. My own work in Mexico. I've really been struck since I've been here, and we formed a group called Penn in Latin America and the Caribbean to see the depth and the breadth of Penn's presence in Latin America. And again, how important that scholarship and interaction is important for our students, for attracting the diversity that we want here on campus, and importantly for contributing to the region. And when we think about why is Latin America so important, you know, first of all, we think of proximity. We share water, we share air, we share people. And when, I forget who it was who said, is when the US catches a cold, Latin America catches pneumonia. And so we see, you know, the economic impact of what happens in the US profoundly in Latin America. We are affected by the political and civil unrest in Latin America and how that affects immigration policy. So we all have a large stake in what happens in our own neighborhood, in our own backyard. So again, the resources at PLAC, the support of the Perry World House, and again, our opportunities to work as a collaborating center in the region is of just utmost importance in the whole global health arena. And I'm pleased that it's a priority of our school, and again, rising prominence here within Penn's campus. I think, as Dr. Cassiana said, you know, again, when we think about COVID and nurses, we've been here before. You know, nurses have been very present in epidemics and pandemics before. When you take a look at what happened in 1918, for example, in one of the worst the Spanish flu epidemics, nurses were out there front and center, not just in caring for patients, but also in the public health, in applying good public health principles that, of course, we learned from Florence Nightingale, who was a staunch supporter of good hand washing, proper sanitation, and sound preventative measures like face mask. As Dr. Cassiana said, nurses are leading here in this country response teams that demonstrate their skill and their expertise, such as disaster preparedness, predictive modeling, hospital and field operations, and human resource management. You've also seen nurses as strong advocates, as we're talking now about opening schools and the importance of school nurses in making sure that students and teachers are well taken care of. We're important in terms of the testing. It's many of the nurses that are out there in the parking lots in their hazmat suits doing the particular testing. It's also in the testing of vaccine trials. There's going to be a huge vaccine trial that's taking place here at Penn. And it's, again, nurses that are going to be moving on this. And importantly, using whatever microphone we have, using social media as well as the media to educate the public. Now, this comes at a huge consequence for not only nurses, but all healthcare providers. We've seen the consequences and the impact that accidental or because of lack of adequate protection exposure to the virus has had on both physical and psychological fatigue. I think Dr. Cassiani might address this later, but in some Latin American countries, healthcare providers and nurses in particular are being assaulted in their communities. They're seen as being dirty. They're not allowed to come into their communities. And again, this has caused, specifically in Mexico, an international uproar. So again, even when doing good, we're seeing, you know, we take on the issue of victims. So, you know, again, you know, just the existing working conditions, both in Latin America and the US, short staffing, et cetera, are exacerbated by this pandemic. But I don't think that deters nurses from doing the work that they need to do to keep populations healthy, both in the hospital and in communities.
Thanks so much. You covered a lot of the ground, at least of some of the initial questions I wanted to ask. But before we go any further, I wanted to ask you both about 2020. Before we started thinking of this as the year of the coronavirus, it was the year of the nurse and midwife, and this was a declaration of the WHO to honor these professions. We'll probably spend the rest of the hour talking about COVID-19. So before we do that, I wondered if you could each say something about that, the year of the nurse and the midwife.
Sure, I'll start, Sylvia, and then maybe you can talk about specific in Latin America. Mm-hmm. So yes, 2020 was going to be a year of great celebration, the year of the nurse and midwife, and it was a designation by the World Health Assembly. And this is important because it's the first time that the World Health Assembly has created a year of for a particular profession. And so why was that so important, or why recognize nurses? Well, one practical recognition is that it's the 200th anniversary of the birth of Florence Nightingale, who is the founder of modern nursing, a pioneer in public health and the use of data visualization, and an advocate for social reforms. But importantly, the recognition of nurses and midwives during this health assembly was done in recognition of the importance of nurses in the workforce, and to try and elevate the key role that nurses and midwives play in contributing to United Nations Sustainable Development Goals. And so why is this opportunity so urgent? So think about an industry in which a key group, which constitutes over half the workforce, is facing an enormous workforce shortage within the decade. Imagine an industry of key end users who possess critical evidence, expertise, and experience, but who are excluded from planning and strategy decisions by policymakers at the institutional, regional, national, and international level. Imagine an industry in which half the workforce has the education and skills to address the most perplexing programs in a way that benefits both the economy and the population. But imagine that this well-educated and trusted workforce is prevented from working to the full scope of their education and license in a way that restricts and diminishes practice and innovation. This is the situation of nursing and midwifery in most countries around the world, whether those countries are research rich or poor. So currently across the globe, nurses and midwives account for nearly 50% of the healthcare workforce globally, yet the world is experiencing a shortage of healthcare workers, and nurses and midwives collectively comprise 50% of that shortage. So this is a global phenomenon, and we're experiencing it here in the US and Latin America because of the adage component of the age of the workforce. So people are aging out of nursing and midwifery. In addition, in the United States in particular, there has been a high reliance on international nursing, and because other countries are experiencing that shortage, that's a supply area that we're not going to have much resources. So despite our numbers, the highest percentage of the healthcare workforce, the expertise of nurses and midwives is consistently underrepresented in middle and high level policy discussions and decision makings at the institutional level and at the governmental levels. Nurses and midwives have these requisite skills. It's what we're educated for. It's important both in terms of economic production and in terms of gender equality. But because of our lack of representation here, we are prevented from practicing to the full scope of our license, not just in the United States, but all across. So again, this has a significant impact on the health of the public. So the idea of this report was to, again, systematically document what is the state of nursing across, taking a look at population, taking a look at policy recommendations that were in place in countries, to serve as a benchmark and as a call to action to governments and policymakers to elevate nursing in these policy areas. And Sylvia, I know you will speak specifically to Latin America, but everything that I'm saying is absolutely true. So I know we would be interested in hearing specifically about findings in the Latin American region.
Yeah. In terms of the region, and looking at the Latin America and the Caribbean, as I said, we have 8.4 million nurses in this region. It is about 30% of the nurses in all over the world. So we can say that 1/3 of the nurses in the world are in this region. The issue is that a few countries has more than half of these nurses. For example, United States has about half of these 8.4 million nurses. So imagine, as Tony said, one country with half of the nurses and the other countries with splitting the other half. But Tony said very important aspects. We need investments. So talking about Latin America, we say that it's a call, as she said, for investment. We say that human resource for health, they are not cost, they are investment. And looking at what we are facing this year with this pandemic, what would be without nurses? Nurses are the pillars of the health systems. But the full potential of nursing and midwifery has not been used in Latin America. We needed to discuss more to the governments, ministries of health, education, and labor, that they can trust in the education that the nurses in this region, especially in Latin America, they have. We needed to work to expand their roles in public in health or in primary health care. Pajo talks a lot with expand services at the primary health care. We know that primary health care services, they can deliver and they can be resolutive in almost 80% of the cases. So imagine if we have nurses with autonomy, with full recognition, with a good working conditions, and education, a quality education, and motivated working in those places. So the solution of the problems of the clients and the population, the nurses with their education, they can deliver. We needed to improve and modernize nursing regulations in Latin America. We needed to give them a better working conditions. We have to discuss about the migration of nurses, especially in the Caribbean, and we are facing that with the pandemic, the migration will be increased a lot in the next years. So the migration is not just in the Caribbean, but also we face in Latin America. But we have to say that, and Tony said very well, this year is the celebration of the year of the nurse and midwifery. It's the pandemic that do not allow us to celebrate as we should do, but can be an opportunity for the discussion, for leading the positions of nurses and midwives in the countries. Next month, we are starting with WHO a policy dialogue. We are giving tools for the countries to use this important report to create opportunities, to create a discussion, and to transform and to influence health policies in terms of the health workforce and also nursing workforce. So we hope that with this, we can lead this position to leverage the nursing much more in the countries.
So you both, you started to touch on my next question, but I'll ask it anyway and maybe try to ask you to elaborate on a specific part. So in preparing for this, Dean Villarruel, I was looking at Penn today and saw you quoted as saying that when it comes to pandemics, it's nurses who are on the front line who spend the majority of time with patients who put themselves at risk. And so I guess one of the things that I was wondering is, it seems from as an outsider that we collectively across the Americas are failing nurses in this pandemic as they are, on the front line. I'm just wondering what kinds of, you both mentioned the need for more nurses in education, but what other kinds of policy changes need to happen? And it sounds like there's currently a forum for this discussion to happen at the highest international levels. I don't know if you wanted to start, Dr. Cassiani, what specific kinds of policy changes are required?
Yeah, it's not change the policy, but influence policy. We as nurses, we call for health for all in all policies. But we also want to contribute more, to sit in the decision tables, to discuss about the health of the communities, the health of the population, and to work interprofessionally. So we are looking for interprofessional education. We are looking for working in collaboration with other health team, with the team, but also to recognize the contribution and all the education that we have as nurses. We reported a lot of issues related to the working condition, and this is not new to us. It's not the pandemic. As you said, we have several nurses died from the virus, and many of them related of the working condition. We also need from the health policy good data, to understand the country's health workforce, the perspectives. As we could see, many of the countries in Latin America, especially, did not have good data. So how many nurses you have on demand? How much nurses is your supply? So sometimes this kind of data is not well practiced in the country. Even though they reported informed about data in Latin America. And Tony mentioned that we are almost 50-90% of the health workforce. Mm-hmm. We also need investment in retention schemes, like I said, in the Caribbean, in other countries. We need gender-sensitive policies and also an acceleration of nursing education. The region needs more nurses. And to do this, we need to accelerate and use the experience of United States to produce, to increase the supply of nurses as United States have done in the past years.
Mm-hmm.
So I do think that there are some changes that are needed to protect not only nurses, but other frontline workers. The first one is access to PPE. I think we're seeing shortages in the Sun Belt, for example. Again, the same supply chain issues that people don't have what it is any of the frontline workers have what they need to be protected. So that has to happen. The second thing is that there has to be in place adequate psychological and social support for these frontline workers. This is like a PTSD. I think the stress of frontline workers in the hospital is huge. And then you go to this, oh my gosh, I have to go home and I have a kid, I have a sick parent. How am I going to be able to protect them? So some systems have been very helpful in providing housing, for example, or providing meals to, again, decrease the risk that hospital workers may or may bring home, and that should happen. I was pleased to see that the governor here in Pennsylvania just implemented some hazard pay for frontline workers. I don't think nurses will qualify just because of the income level, but again, that's a step in the right direction. I also think there's been some good changes, good policy changes that have happened as a result of COVID that have allowed nurses and other healthcare providers to decrease regulatory barriers and to increase the scope of their license, practice to the scope of their license. So one example is in the area of telehealth. Regulations that had to do with, again, state licensing and borders and payment have all been eliminated, so that if you're licensed to practice as a physician or as a nurse in one location, you can provide telehealth to somebody else in another area. Nurses and PAs, as a result of the loosening up of some of the restrictions, are able to bill for and provide these telehealth services, which again is an important, people are still in need of care, and telehealth seems to be the only way to do that. There's also been a number of, again, crazy restrictions that have been placed on nurses and other folks, so that in the home health care area, for example, only a physician could prescribe palliative care, and when really it's just the nurse calling up the physician to say, hey, you need to do this. And so some of those barriers have been removed to allow, again, nurses and others to practice to their full scope. So, in a crisis, we tend to be a little bit more innovative and try what we need to do. And our hope is that these regulations, because they, are important, they're necessary, and are not dangerous, can be implemented once the epidemic is out as well. So those are examples of some policy changes.
No, those are great. And just a brief follow-up to that, has it also changed how you're leading a school? Has it changed how you're thinking about the future of nursing education?
Well, I like to say that we've moved, 20 years in 2 months. So the idea of using virtual remote education is something that we had never, I'm not saying we never have done, but I think we were, like many bricks and mortar college, Ivy League colleges, have been slow to adopt. And now that's pretty much the norm. And so I think we're looking at everything that we're doing and saying, not only does it make sense in this pandemic, but is it going to make sense moving forward? So, our faculty and our students have jumped in, have been innovative, have been willing to try different things. I mean, we have to, given our environment. So those changes will continue. I think certainly preparing nurses for telehealth is something that was, very little, but it's something that I know is going to be routine, because people are not going to go back. I mean, the telehealth component, that's the genie's not going back in the bottle.
Sure.
So we have to prepare our workforce to be able to do that.
So I have one. I get one more question before we turn it over to the many questions pouring in from the audience. But since the three of us are all interested, especially in Latin America, as well as the United States, I just wonder if you could comment on what seems to be. It seems like this disease has been really devastating in the United States and in Latin America. And what have we done wrong, or were we just unlucky? That's a brutal question. So you guys can choose who goes first.
I'll start. I think we have different perspectives, and I unfortunately we don't. Maybe Sylvia, you can point to some good countries that are doing well in the Latin American region and moving in controlling the epidemic. the U.S., sorry to say, is not a leader in that initiative. And when I look at what the issue here is with our country, I'll say it's a lack of national leadership and consistent evidence-based regulations that move forward. I see similar situations happening, for example, in Brazil and in Mexico, where the leaders mock the science and aren't taking this seriously. And I think choosing to present false narratives between the economy and health and restrictive and integrating this issue of freedom and freedom of choice and not recognizing the collective responsibility in terms of community health. So that's where I see it. Would be interested in your perspectives as well.
Until the last week, United States, and I feel that this week is the same as I did my research. The United States and the Brazil combined, they have 76% of all cases of COVID and 71.3% of all deaths. So just these two countries, no? But the issue with the COVID that is concerning PAHO is not just about the patient itself, is that the continuity of the essential services of the first level of care was affected, So we have, especially in rural population, indigenous population, since several primary healthcare services was closed, because the health professionals were transferred to the hospital. So we had the disruption of services related to NCD, cancer patients, also the cancellation of elective services, immunization of children, prenatal care. So all these other topics of health were discontinued, And the countries have used the mobile stadium, hospitals, and also alternative healthcare sites, The training of healthcare professionals, especially with nurses, because several nurses didn't have the experience to work with this control of disease or patients in this situation, So PAHO had worked with the countries providing training to several nurses and also to provide an estimate of the necessary human resources. Tony said that in terms of the school, they have to accelerate 20 years just in 2 months, And the countries, they had to do the same in terms of the health services, They didn't, they were not prepared to have the intensive care units and also personal training. So the pandemic was like an accelerator of change. But the issue is that the issue of the weak health systems, that we had in several countries in Latin America also, but other countries as well, So the health systems, they were not prepared. They were weak. They had lack of resources, lack of human resources. They were not investing in education, in training of the personnel, and also in terms of the labor itself, the contracts. So we had the good experiences of countries that have declared the COVID as an occupational disease for nurses, Otherwise, they will stay at home because they had quarantine, and they were not paid, Or sometimes their contract was finished, So we have good experiences, but we have others that show that the health systems, they needed to be strengthening in every country.
Okay, thank you so much. So now we have many.
Michael, what are your thoughts? I mean, you've done a lot of work in Ecuador, and I think Ecuador was good and then not so good for a period of time. So be interested.
I guess I agree with Sylvia. I just think that it was even in a country like Ecuador that had a reasonable health system, it was just overwhelmed very quickly. I mean, it's happening in the United States. It clearly is going to happen in a country that's not as developed. But I wish I knew. I mean, there's some speculation that there were particular contingent facts, like a lot of Ecuadorians had been in Madrid for vacation at just the wrong time. But you know, that I don't know. But I think we saw. I think it's very interesting that this is a case of a disease that good old-fashioned public health would have helped a lot, and that was not really the emphasis in health systems that we know about. And I think we see it really does reinforce the importance of nursing and public health to manage a crisis like this. So but that's the amateur speaking. So here's the first question I'm going to ask from the Q&A, and we'll never get to all of the wonderful questions. But someone asks, indigenous communities seem to be disproportionately affected by this disease. What are the biggest challenges in a pandemic, or in this pandemic, or in any pandemic, in working in these communities? And is there anything that we can do from abroad?
I can start. It was something hard to hear that the indigenous population in Latin America, they were infected by the health workers that were there to help them. So, and also because of the mobility of this indigenous population to the city. So the health workers that went to these tribes to help them, suddenly they were responsible for infecting them. You know? And we know that many indigenous population, they do not have access to health services. They do not have easy access because sometimes they are far from the cities. No? And when they go to the cities, no, this transportation is hard. They need a helicopter, they need boats. Even in Brazil, we have an issue. No? So we need to think, as we are discussing about the COVID as accelerator of changes. No? This population that we are in remote areas, so out of the cities, no, how they can have a better access to health services, no, is a human right. The health is a human right, no. So the access to the health services and also access to professionals, health professionals. We know that many health professionals, they do not want to stay in these remote communities, no, far from the cities, no. So who is the person who is able to stay with the community? It's a time to think that maybe we need to invest in the community health workers, to invest also in the training of the community as nurses, as medical doctors, where they can stay there and they can treat the population. So it's very difficult. We heard in Brazil several cases, so it's very difficult to hear about this indigenous population. But we also have COVID in the prisons, too, with the persons that were in prison. So as we are discussing about health and health systems, no, these people that is out of the services, no, because they cannot have access. We need to improve access to everybody. No, if one is sick, everybody is sick.
Mm-hmm. Did you want to add anything to that, Tony?
I'll just say that, our Native American communities are absolutely devastated. And Sylvia, it's not only the lack of health care, it's lack of water. They don't have access to water to do hand washing. So, again, when we talk about, what's needed to change, it's, again, the conditions where people can exercise good public health measures. So
This is one more way that poverty and lack of access to resources kills people. We might say, yeah. So there are several people picked up on the comment I think you made, Tony, about PTSD. So I'll just read one of them as an example. I've lost many family members to this virus, and as a result, I have concerns about how minorities have been overwhelmingly affected by COVID, and it causes hesitation working in a clinical setting. In addition, I think the PTSD is true and raises some challenges when considering the future for nurses like myself who've been personally affected. So what resources or support could be provided, should be provided?
Yeah, one of the things that we're doing, that we're working in partnership with Penn Medicine, who, again, first of all, recognizing that there is real trauma in what people are facing both in and outside. So number one. And the second thing is mobilizing resources that exist. Within Penn Medicine, they have a great support system for frontline workers, and I'm pleased that our Penn nursing students, our advanced practice mental health practitioners, are providing services to those frontline workers as a hotline to listen, to help debrief, and then also to refer as needed. So again, I think we're going to see a lot of innovative strategies to be able to help. I know a lot of professional organizations are moving forward. I think, even pre-COVID, there had been a big movement about clinician well-being from the National Academy of Medicine, recognizing, again, the stress that healthcare workers are in increasingly because of the situations that they deal with. And I think COVID has elevated and certainly shined a light on this particular issue for everyone. So those are some steps.
Another related question is that one of the people on the call mentions that Israeli nurses just finished a strike themselves, calling for 2,000 more nurses. And this was, I think, in reference to when you were discussing what concrete policy steps could be taken. I guess the question is, what should nurses take job actions, or what can nurses do as a collective to really amplify their voice and to have more attention paid to their issues? You guys being two of the representatives of the leadership of nursing through the Americas.
Yeah, I can start.
Sure.
First of all, we needed to work together. No, it's not nurses talking to nurses about nursing. No, so we needed to have together the government, to have the parliament, to have the ministries of health, labor, education, treasury, finance, and all these stakeholders. We needed to have the other professionals, and discussing about the contributions of nursing to the health of population and what else nurses can do to improve the condition of health of the country. It's important in the countries to have the leadership, the right leadership. Sometimes it's a group of the CNOs, the chief nurses officers, with the colleges of nursing, the universities, and also the nursing associations, and also the colegios de enfermería. So both of them will discuss the situation of the health of the country, and how nursing and midwifery can improve this situation. So we are looking not just ourselves as a profession, but what can be done to improve the situation of the country in terms of health. So this plan together, with these other key stakeholders, and with the support of the government and also the universities, can influence the policies. We needed to lobby more about what nurses can do to improve the situation of the country in terms of health.
So, I'd like to say that, at Penn, we have a Center for Health and Policy Research Outcomes, CHOPPER, run by Linda Aiken. And again, her group and her colleagues, not just in the US, but in Latin America, in Chile in particular, and around the world, have demonstrated that an educated workforce at the baccalaureate level improves patient care outcomes, decreases mortality, morbidity, etc. We have the evidence that we need. What we need to do, as Sylvia said, is change the political will. And I think there have been a number of, again, thinking about work in Chile, it's again, talking to the Ministry of Health, providing the evidence and saying, this isn't something that you're doing for nurses. I mean, when we advocate for nurses, we're not advocating for us as a profession, we're advocating for the health of our communities and the population. And that's what we're framing. We're saying by investing in this type of workforce, you're going to have better outcomes. And so the legislation is one. Getting the allies to be able to do that is another one. I think here in the United States, we have a designation called magnet hospitals, which again, part of the criteria for this designation is, it's like a good housekeeping seal of approval. You know you're going to be getting good care there. And people know that that's a market driver. So people want that magnet designation. In order to get that, they have to have a more educated workforce. So again, that wasn't a governmental policy. It was sort of a market policy that, again, based on evidence, a lot of it created here at Penn Nursing, that this type of evidence and background will create those patient care outcomes. So if you're wanting to attract physicians and patients to your place, you're going to make sure you have world-class nursing. I mean, I do tell my colleagues that Penn Medicine, as great as Penn Medicine is, you cannot have a great facility unless you have great nurses, and they have great nurses.
Can you give an example of a like what would be one policy that maybe a conventional hospital wouldn't have that this magnet hospital designation would have that's nursing related?
So a couple of the indicators are, number one, a high proportion of baccalaureate prepared nurses. Number one, because we have evidence that says baccalaureate prepared nurses are important. The second one is that nurses are involved throughout the healthcare system in making the needed policy changes that need to happen. So again, they're involved in decision making from buildings to rooms to staffing to patient flow. So they're involved in the operation of the organization. I will just have to again shout out here, because we are so fortunate in our region that we have 3 nurses, 3 of them who are Penn grads, 2 Penn nursing grads, who are the CEOs of the hospitals. So CHOP, the Children's Hospital of Philadelphia, the Hospital of the University of Pennsylvania, and our VA system are all run by nurses. So again, CHOP and all of them are magnet associated, because again, it's this hospital that recognized the investment that's needed in the workforce to produce the patient care outcomes.
Mm-hmm. While we're, I'm sorry, go ahead, Sylvia.
No, Mike, I want to add that we also have nurses in the countries in a high-level position. In Costa Rica, one vice minister of the vice minister of health is a nurse. We also have a nurse who was a minister in Peru, and we have several nurses in the parliament. So, looking at the nurses in these political tables, in these positions, they are very helpful to look at the position, look at the health of the population, and also to give some recommendations to nurses who are in the position of the chief nurses officers and others.
So while we're on this topic, if you could give a characterization of how does you're saying these really remarkable hospitals have nursing leadership. What's a sort of nursing perspective on health that might be a little bit different than the perspective of a physician, let alone an accountant running a hospital? What is having a CEO as a nurse maybe bring to a hospital?
So if you were to ask me, I think it's a holistic perspective. It's not just on just disease management or procedures, but it's again taking holistically of the whole patient and the family. It's
Mhm.
making sure that they are integrated into all decision making, it's the operations of the hospital. So again, it's keeping the patient and the family central. It's again, not only when they're in the hospital, but when they go home, when they heal. It's paying attention to quality and safety. It's the ability to lead interdisciplinary teams. So I think those are perspectives that, again, aren't unique to nursing, but I think are a strength of what we do and what we bring. Again, thinking that we are the largest healthcare workforce in hospital systems, to have a leader there and to raise voice so that, again, our voices are heard at every level, at the unit level. Again, building interdisciplinary teams where nurses both participate and lead and practice is collaborative. I think that's what nurses bring to the table.
Yeah, and we are the majority in all the health system, not just at the hospital level, no? We are 59% of the health workforce. And in several countries, it's around 70%, 70% of the health workforce, they are nurses. So why not they are in these positions?
Excellent. So as the hour's coming to close, one thing we like to ask guests are thinking about the kind of next generation, and obviously both of you are deeply involved in education. But Perry Worldhouse is about global affairs. You both are involved in global health. If a student was interested in beginning her career and thinking about global health, what do you think is a good course of study, and what kinds of experiences? I mean, right now, of course, we can't go anywhere because of COVID-19, but how might someone organize their studies, whether it's in nursing or one of the other health professions? Sylvia, did you want to start with that one?
I would say to these young students, no, in this region, the nursing workforce is aging. No, we have around 30% of the nursing workforce with 55 years or older. So they are expected to retire in the next 10 years. No? So we need young people in this profession. No? And even though we have places to replace, we do not have enough nurses. No, so we need more nurses. But we also need male nurses. No, we need men in nursing field. To achieve a gender balance. It's not just young people, but we also need to achieve a gender balance. I would say that nursing services, they are essential components of the Sustainable Development Goals in universal health coverage. They are core of the primary healthcare teams. In many parts of the region, nurses are the first and sometimes the only, as I said, human resource in contact with the patient. And in all settings, they are essential to improve access and coverage by health systems. No? And in United States, 85% of the Americans said that nurses are honest and they have the ethical standards. Is the Gallup interview that showed this in other countries as well. And finally, I would say you will never have difficulty to find jobs. Sometimes it's not well paid, sometimes it's not well recognized, but they are jobs for nurses in all over the world.
It's very interesting that you in the course that you mentioned about the Gallup, the high opinion. I mean, that suggests a role. I was talking about healthcare in general, but a role for nurses in particular may be as frontline health communicators, and especially in this time of so much misinformation about COVID-19. I mean, that's we have a great center at Penn. Kathleen Hull Jamieson runs that thinks about these kinds of issues. So this is worth a program in itself to discuss that. But Tony, I wonder if you could answer, and in particular, like if a student of yours was interested in a global perspective on health, if there's a path that you could take them on.
Of course there is. So, you know, we're a school of nursing that has a worldwide perspective. Our faculty are involved globally, not only in Latin America, but in Africa and Europe, I think just about every place in the world. So our faculty bring that. Our students bring that. They bring that particular interest. We do offer a global health minor. And so we have, I see my colleague Nancy Biller here is on, takes a good time with students to help them identify what their particular interests and then direct them to faculty in the school, but importantly to direct them to areas across campus. This is why I see Richard Perry is here. We're so grateful for the Perry World House, because that is a place where students can congregate and learn and can have great dialogues with the Vice President of Ecuador, for example, or from the ex-President of Mexico. Where else can that happen? We also bring a lot of global visitors to campus, and so again, to hear about what's going on in Rwanda or in Botswana, I think is important to do. I think, as our colleagues like to say, is you can go international just by looking at the community enclaves in Philadelphia. So you can go to Puentes de Salud and hear about the stories of the recent immigrants that are coming from Latin American countries, and you can go to Chinatown or South Philly and talk to Vietnamese refugees. So again, we believe in bringing the world to Penn and having our students go outside, and there's just plenty of opportunities across campus that our students are really have the privilege of taking advantage of. So again, minor, but again, there's just so many things to take advantage of. So
in closing, we always ask our guests about things that make them optimistic. And I mean, this was a very heavy conversation, thinking about PTSD experienced by healthcare workers and devastation in indigenous communities and Native American communities in the US, and that even in the richest country in the world, there's not enough PPE available for nurses. But all of that said, I mean, does anything that you've seen during this time give you hope? Local, national, regional, international, and in particular, do nurses bring you hope?
Well, I'll just say for me, yeah, I'm very hopeful. I think this, the pandemic has shaken up things as to how they used to be. And I think we have a real opportunity to seize this and to make it the opportunity that we want to be. So even though in this year, 2020, we weren't able to have all the celebrations and parties that we had planned for, I think people recognize, I'm hoping they recognize not only people as heroes, but recognize the centrality and the importance of nurses in achieving health for the public. So that's what makes me optimistic. And I think, Michael, I want to thank you and Perry World House for giving this opportunity to elevate nursing in this pandemic. And again, it's always great to be with my colleague Sylvia. But Sylvia, what makes you hopeful?
I'm sure that the pandemic has created the opportunities, to expand the discussion of the working conditions, as we said, the deficit of nurses, and to highlight the human resource for health as essential workers to keep society moving on. Without them, our situation will be much, much more hard. And to conclude, I want to say thank you so much for this opportunity. Thank you for our PAHO WHO Collaborating Center in the University of Penn, where Tony is the dean. they are helping and they are supporting a lot PAHO in the work with nurses. We had a wonderful meeting last year, so maybe next time Tony can talk much more about what they have done. And it is a historical event that we had for the Latin America to discuss the future of nursing, the future of nursing education. So our PAHO WHO collaborating centers, they are arms that we have in WHO and in PAHO to expand the ideas, the principles of health for all. So we count on them, and the university and the College of Nursing, they are so supporting in this mission, in this principle of PAHO and WHO. Thank you so much, Tony.
Yeah,
and your colleagues.
Thank you to both of you so much. And I'll just say, we hope, I hope that it's not always COVID-19 that brings us together, that we, there's many, many people on campus interested in global health and Latin America in particular and nursing. So hopefully in the coming years, we'll have many more events together, hopefully in person. But for you and for everybody on the call, thank you for spending your afternoon with us. This is the last of our summer series of The World Today, but we will be one way or the other starting back up come fall, and everybody look out for our emails. Thanks again to Dean Villarreal and to Dr. Cassiani. It's been a real pleasure speaking with you this afternoon. Thanks, everybody.
Thank you.
Bye-bye.